He's just an awesome pharmacist.
He's got a very good heart.
I've been with Javed for 8 years. He was the pharmacist at Seabird, and he's been just a great guy all around. Like, he helps anybody no matter what the situation is. Like, I had heart failure last November and he was always there. Like, if I couldn't get into the doctor's office, then he would say, well, I'll give you the prescription under my name, right? So, but he's always been there for our people.
Whatever I need, he'll provide. But he has to go through channels with the doctors and whatnot. You know, if it's things that I really need, like I have problems with my health. With COPD, I have problems breathing. And he'll go out of his way to help.
We first got to know him when he was at Seabird.
Being open is part of it. I think putting an effort in to communicate clearly with patients and making sure that he understands what they're trying to say to them in terms of what their problem is or what the issue might be. So actually listening to them and then making sure that they understand the instructions that he's giving to them. So he's very good at communicating across cultures.
Dr. Fox and I, we work very closely together. So when I was working at Seabird there, so it was just communication. Communication is very important among the healthcare professionals. We have to work as a team. With the nurses, the doctors, you name it, everyone, we have to work as a team. If we don't communicate with each other, nothing's gonna happen. So at the end of the day, when the patient walks out there, it's not he or she end up walking from a doctor's office or a pharmacy or a nurse. He walks from a healthcare settings. So we all need to be together and communicate with each other so that we can provide the best outcome for that patient.
Sometimes you're having uncomfortable conversations or what feels like, you know, real personal conversations about a client or yourself, and it's business and he cares, and that comes across every time.
And if he doesn't know or doesn't know the depth of the situation, he always investigates.
100%. Yeah.
Absolutely.
Yeah. He goes above and beyond, and he understands the etiology of their issues and with the medications alongside. So he can explain that to them.
Patients feel comfortable when they're around him. So that no matter what you look like or what culture you may be coming from, he's going to make you feel comfortable and not judge at all, and he's just there to be helpful.
You have to listen to the people. That's the main thing. When they walk in there, you have to listen to them, what are their needs. So if by listening you have done almost 75% of the job there, that's the main criteria. Then from there you can decide what's the next step.
He knows about the Indigenous people and he knows what their needs are.
There are some patients who honestly just need to talk to the pharmacist and get a quick consult and get their medication maybe renewed. That before could not have happened, but now that can happen. So instead of having to wait to see me for a month, they can now see Javed, and that frees up an appointment for someone else.